Today, the topic that I'm going to explain is the differential diagnosis of chest pain and angina. As we know that differential diagnosis means that there can be many different reasons of the diagnosis behind major symptom. So chest pain is a symptom of many different diseases, including angina. So the main difficulty here is the diversity, that how the diagnosis of patient is very difficult, as chest pain is a symptom of many diverse and different diseases. So we have to extensively rule out the different diseases depending on several other symptoms. The range is from musculoskeletal abnormalities as that goes to the lethal cardiac diseases. So now the main cause of the chest wall pain is actually musculoskeletal pain or cardiovascular pain. This musculoskeletal pain, as it is defined by its name, includes the muscle and the skeletal pain. So it can be of skeletal tissues or of basically skeleton, including the bones. And of the muscles, their blood supplies. And cardiovascular includes the heart and heart vessels and its muscles problem. So now the musculoskeletal pain includes rheumatic diseases, costovertebral joint dysfunction syndrome, non-rheumatic disease, and costochondritis. So now thoracic joint and rheumatic diseases are actually including in the rheumatic diseases, which means that it is actually the inflammation of the joints, including rheumatoid arthritis. And ankylosing spondylitis. Now, ankylosing spondylitis is a very wide term, but majorly it means that the fusion of the vertebrae, which means that the posture becomes very hardened and there is an inflammation of the spine, which makes a person difficulty in moving, and there is a lot of friction. So now the person is having bone fusion, difficulty in spine, difficulty in sitting and standing, and which also includes that it includes some kind of chest pain. The non-rheumatic disease, actually it is less than of the inflammation of joints, but it is secondary as it is due to some other diseases which ultimately attacks the musculoskeletal areas. So now, due to very harsh cuffing in diseases such as tuberculosis, or due to vasospasm, which is actually the constriction of the blood vessels, which stops the blood supply. So in this way, there is are stress fractures in the inside the arteries or in the muscles of the lungs that causes the musculoskeletal or chest pain. Now coming towards the cardiovascular pain, so it is the valvular heart pain, which is the aortic stenosis, the coronary artery disease, ischemic chest pains, and coronary vasospasm. So it is mainly including into the it is related to the hindrance in the blood supply, how the arteries can become constricted or dilated, which ultimately causes increased blood supply demand or decreased blood supply demand, causing a stress on the chest and the heart, leading to the dysfunction of the heart and ultimately causing the chest pain. Now, there are some certain other syndromes that causes the chest pain, which includes non-ischemic cardiac syndromes. Now, non-ischemic means that it is not related to any kind of difficulty in the blood supply or hindrance of the blood supply. So it includes the pericarditis and myocarditis. Now we know that pericardium is the tissue that surrounds the blood, surrounds the heart. So as there, if there is any deformity in the pericardium, that there will be more friction and there will be a hindrance in the blood supply, as explained here, that there will be pericardial friction rub, and the pelluretic in the quality, which means that as we know that the pelluretic quality means that it is a very thin film inside the lungs that actually pelluria that actually if act as a wall between the lung cavity and the chest cavity. So when there is a friction involved, it involves the rubbing of the chest cavity with the lung cavity, which causes a difficulty in breathing as well as chest pain. So now it has a sudden onset, and its major location is the interior chest, as it has a pelluretic quality. Secondly, it has a decrease in intensity by sitting up, as it causes a change in the posture, and the ribs causes the heart and the lungs to move back and in the upright position, which actually which actually causes the radiation of pain into the trapezius ridge. Now, secondly, is the myocarditis. The myocarditis is actually the chest pain or inflammation in the myocardium, which is the muscles of the heart. If there is any kind of inflammation inside the heart muscles, it causes difficulty in the relaxation and the contraction of the heart muscles, causing difficulty in the pumping of the blood. And now it causes acute aortic syndromes and intramural aortic hematoma and penetrating aortic ulcer. So these are the causes of the myocarditis. It is actually also linked with the chest pain. So a person has to, the doctor has to rule out acute aortic syndromes in order to term that whether the chest pain is caused by non-ischemic cardiac syndromes or not. Now, there are certain other causes of the chest pain, including the hyperandrogenic and adrenergic states. As we know that catecholamines are caused, released by the adrenal glands, including epinephrine, norepinephrine, and dopamine, and several other hormones. So they have a direct reaction on the peripheral circulation, that is the venous system. So now, as the venous supply is changed, sometimes there is a rushing of the catecholamines, causing the rushing of the blood inside the veins, causing the stimulation of the heart rate and ultimately vasoconstriction. Because the vessels are highly constricted, it causes a very rushy and gushy motion inside the fight or flight situation, causing the high blood supply and blood rate, ultimately leading to the chest pain because there's a rush of the blood, but the walls are very narrow due to vasoconstriction. Second is cocaine and methamphetamine. These are basically intoxicants. They also causes the rush situation, and they are causing the increased demand of the oxygen to the brain and also to the heart. So in this way it causes the chest pain. And certain other causes of the chest pain are hypertension, increased blood pressure, vasospasm, and tachycardia. Now there are gastrointestinal causes too, as sometimes we experience that when a person is having certain gastrointestinal syndromes such as esophageal hypersensitivity, abnormal motility pattern, and achalasia, esophageal rupture and perforation due to any infection or foreign invader, and esophagitis, that is the inflammation of the esophagus. It also causes a difficulty in breathing and also leads to the chest pain due to the accumulation of the gases inside the gut. There is a pushy situation towards the chest wall, which leads to the pain. As you can see on the right side of the screen, that when there is a peripheral sensitization, it causes a psychological comorbidity on the brain, and known acid such as reflexes, gases, and bile, esophageal exposure in the stomach, that and including the acid esophageal exposure, that ultimately leads to the esophageal motor dysfunction. So in this way, the stimuli or the gaseous stimuli is causing a motor dysfunction, and which ultimately causes abnormal motility patterns in achalasia and certain other inflammations. Now coming towards our main thing, that is angina. Angina is actually a continuous discomfort, but it actually depends on the situation, as it prevails for a very short period of time. It is maximum its maximum time limit is from 2 to 3 minutes, and it does not prevail longer than 20 minutes in many patients. Now, angina is actually the myocardial ischemia. That means that it leads to the increased demand of the myocardial oxygen supply. As oxygen supply is needed, which means there is an increase in the heart rate, the systolic BP will change. That is known as the afterload. That is known as actually the afterload, and myocardial wall tension stress, that is known as the before load. I'm sorry for this mistake. This is known as the before load. And then there is the myocardial contractility. So now in this way, there is tension and stress on the walls of the myocardium, that is the heart muscles. The systolic or the when the heart is not in the resting position, the blood pressure changes, and then that ultimately causes the increased heart rate, because the heart is requiring an increased amount of oxygen. So its characteristics include an inexplainable pain, just like a tightness or squeezing situation on the chest, including the strangling constrictions inside the chest, feeling like a very heavy pain. And it also mimics that, just like something very tight has been binded on the chest, or there is a lump stuck between the throat. But as it is for a very short period of time, which means that its characteristics are not because of a very prevailing or already existing disease, but it is due to a very short period of time.